Welcome to the second orientation for the COVID-19 Rapid Response Training for barbers and stylists, from vaccine hesitancy to vaccine confidence. I'm Omar Neal, and I'll be serving as the host for today's orientation. I'm the former mayor of Tuskegee, Alabama, and the host of the You Got the Power syndicated radio talk show. And I'm elated to have you here as we have a conversation about COVID-19 vaccine uptake and how do we move our people from vaccine hesitancy to vaccine confidence. I'd like to thank our sponsors from the beginning, Black Coalition Against COVID, Barbicide, Shea Moisture, and of course, the School of Public Health Center for Health Equity. And I want to now take this opportunity to bring on a really powerful man. In fact, this whole notion of utilizing the barbershops and the salons for trusted centers for information centers is really the brainchild of my co-host and the lead instructor, Dr. Stephen Thomas. He's professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. Welcome, Dr. T. How you doing today, man?
Hey, Omar, it is such an exciting time to be here. Do you know that we have a full house today? We have over 100 plus barbers and stylists in the room, and they're continuing to join. What a great session we're going to have tonight to get them ready to save some lives. I'm Dr. Stephen Thomas. I direct the Maryland Center for Health Equity at the University of Maryland School of Public Health, and we're providing the platform for your ongoing training. We hope this is more than a beginning, but an actual launch of a long-term relationship, bringing barbershops and beauty salons to the mainstream of addressing not only COVID, but the overall health in our community. And Omar, you know, we got to set the stage for where we are. I'm opening up the newspaper today, and the very first thing I see is Delta. And it wasn't the sorority, it is the variant. And issues around adolescents. My barbers are sending me emails because they're reading stories in the paper about adolescents and vaccines. So we need a safe place for a conversation to get the information people need to make informed decisions. And you're right here tonight. And what a lineup of panelists we have to have that discussion.
Oh, man. Yeah.
You know, we got to set the stage with our sponsors. Let's see where we are in the country right now at this moment in the pandemic.
Well, let's bring on one of our chief sponsors, and of course, the White House representatives, Dr. Reed Tuckson and Dr. C. Bryant Webb, so that they can kind of give us an update from the White House and get us the foundation started as we began our conversation. Dr. Tuckson, you got the power.
Terrific. I think we need to someone needs to open up my video. It won't let me. The host has to start my video. Let's see. There we go. Thank you all so much. Well, you know, I am the warm-up act for the White House. I am Reed Tuckson, the co-founder of the Black Coalition Against COVID. And for all of our barbers and stylists out there, you need to know that the organized Black academic medical teams, the 4 Black medical schools, Howard University, Meharry, Morehouse in Atlanta, and Charles Drew University of Science in Los Angeles. All 4 of those institutions have come together with the National Medical Association, the Black Medical Society, the National Black Nurses Association, all of them together in one coherent arm that is saying to our people, we as Black physicians who have been through and lived with the same distrust that all of you, every one of us has had the talk with our children. I've had it with my grandchildren. My daddy had it with me. I have marched with Black Lives Matter protests. I have been beaten on and harassed the same way that everybody else in the Black community has been. And I will just tell you that all of us understand how angry and upset so many of our community are and distrustful of elites, distrustful of health systems and so forth. We get it, we understand, but we also have come together to make sure that our community moves through the distrust. And we're here to serve your information needs, to make sure that our conversations are rational, based on facts and science, that the Proud Boys and the Russian bots and the racists who love to photobomb everything we do with mischief and misinformation, we're here to offer you the very best that we can. And we are in total partnership here with our partners at Shea Moisture and with the University of Maryland Center for Health Equity. I will conclude my opening comment by saying this to you. You would have to be insane not to understand the purpose, the value, the significance of what happens in beauty salons and barbershops. You are cultural centers of unmatched importance in our community. There are people out here who respect you, who care about you, who want you to be healthy, as people are walking around without their masks on and who have not been vaccinated, exposing you and your family to danger and death. We care about you. We love you. And we understand your importance in our community. We also understand what happens in your shops will circulate either information that will save Black life or information that will swirl around and threaten Black life. In a nutshell, you are very important people, and that's why we're here. So I've warmed up the crowd in a sense, but the White House and the guy who I respect, my teacher on this is Cameron Webb, who is exhibited throughout this fight a tireless effort, an undying love of Black people. You hear me? An undying love of Black people who working hard as hell, that brother does. And so I'm so happy to turn it over to my colleague, Cameron Webb.
Thank you so much, Dr. Tuckson, and good evening, everybody. My name is Cameron Webb, and by background, I'm an internal medicine doctor and lawyer. I usually work at the University of Virginia. I'm the Director of Health Policy and Equity at our School of Medicine, and I've worked clinically on our COVID unit here at the University of Virginia's hospital since the beginning of this pandemic. And so my work clinically has really given me a front row seat of the impact of this pandemic. I remember taking care of patients when we realized just a few weeks into this pandemic that Black people were seeing case rates of COVID at 3 times the rate of white individuals in this country. And we continued to watch those disparities exist, persist, and sometimes grow over the course of the months to come. The disparities in cases became the disparities in hospitalizations, became the disparities in deaths. And so, over time, it became really clear that we had work to do. We have to make sure that we're protecting our communities. And, I'm grateful to have the opportunity to work in the White House where, I'm working closely with colleagues like Dr. Marcella Nunez-Smith, who's the chair of the Health Equity Task Force, looking to help not just in this pandemic, but do so equitably, but also working with President Biden and Vice President Harris, who've said that equity is critically important to them. And that's where this idea of shots at the shop came from. So I want to start just by saying that I'm so grateful that you all are here, that you're a part of this conversation, and that you recognize and value the importance of your voices and of your spaces in helping to end this pandemic. But, seeing the great work that Dr. Thomas was doing in Maryland, that folks were doing in Milwaukee and in Cleveland and in Chicago and in Niagara Falls, and even my barber here in Charlottesville, Virginia, who hosted a vaccination event, seeing that work, it became really clear that barbers and stylists, now you all have been at the leading edge of some of the real public health efforts to end this pandemic. Talking about, the virus itself throughout the course of the past year, then talking about the vaccines since December, and now even holding vaccination events. And that's why we're so proud, so excited to be here with you. And as Dr. Thomas has asked me to do, kind of set the table, I want to be clear, we've made a ton of progress. The rate of cases is significantly down in a lot of communities. The rate of deaths is significantly down in a lot of communities. And at this point, we've got nearly 66% of the population overall vaccinated. And that's all good news, but it doesn't mean that this pandemic is over. Quite the opposite. In fact, where we still have room to go is that we still see more cases in Black people than in white people. We still see more deaths in Black people than in white people. And we still see fewer vaccinations in Black people than in white people. And so that's a really critical role for us to play. You see, the vaccines themselves, they are going to be the thing that helps protect us from getting infected and ultimately dying. And that's why your work, your effort, and your stepping up in this moment is so critical. So yes, we've made a lot of progress. We still have a long way to go. And when we talk about vaccinations, I always start by saying this. I went into medicine to help people. I'm not interested in selling a vaccine, but I am interested in ending a pandemic. And what that means is that we're going to use every tool that we have to help save our communities, help save our family members, our friends, our neighbors, and our coworkers. And that's what this is. This is a conversation about how to do just that. Nobody's going to ask you to go out there and convince everybody you know to get vaccinated. But we do want you to be able to call balls and strikes in your shop. We do want you to be able to speak truth to people who come in possibly unknowingly spreading myths or misinformation. We do want you to be able to create a space for people to come in and possibly have a life-saving intervention that can make a difference in your community. So again, thank you so much for being here, for stepping up, for raising your hand, for all that you already do in your communities, and for digging deep to do just a little bit more. And so with that, I'll turn it back to you, Dr. Thomas.
Thank you very much for setting the stage, Omar.
Absolutely. Well, thank you, Dr. Tuckson and Dr. Webb, for setting the stage. And, Dr. Thomas, what I'm seeing is that we need to find out where the people are and what they're thinking. One of the things that I'm so excited about is that where the rubber hits the road is in the barbershops and salons. And so I want to know, how are you feeling today? So if we can get that word cloud up, maybe we can begin to get an understanding of where you are. We're going to put the word cloud up, and you can put in how are you feeling right now, right?
So and Omar, we got to send them to the chat. There's a link there, audience. Just look in the chat. There's a link there from our technical support team, Cameron. And you just click on that link, it will take you to the word cloud. And you can put one word at a time, but as many words as possible in the next 60 plus seconds.
Right. And I want to see how this word cloud develops, Dr. Cook. We always look for this word cloud and see what people are thinking out there. So you go right now and go to the chat, and you can put your word in and see how it develops. I'm curious to see what is the prevailing sentiment and that's out there today.
And we have some people are putting the word in the chat, and that's fine, because we'll add those words. One of the staff can add those words to the cloud.
Absolutely. Wonderful.
And so take a look here, Omar. Take a look at what's building here, my friend.
Hopeful. Isn't that something? Optimistic.
Okay.
Right? Excited.
There we go.
10 miles, one love.
We're at that last mile community. We're at the no wall in some communities.
Optimistic, blessed, right? Okay.
There you go. Blessed
excited.
That we're here.
Yeah. Now you see, now it's developing. Now we see how it's developing. So you see how hope is getting larger and larger. Dr. Tuckson, you see where we are now, man?
I do, man.
And as you see the words, you may be influenced and you may add. And so the bigger the word, the more people who are feeling that way. So we're going to keep this open. And my staff who are seeing words in the chat box, go ahead and add those to the cloud so we can have an official cloud along the way. Hey, Omar, look around the edges. The hopeful is important, but even the smaller words tell us something about what people are experiencing.
Mm-hmm.
Do you see the words inspired,
right?
Empowered? I mean, do you notice that the word clouds and the people that are putting things in the chat are talking about things like taking charge of their own lives and not being bumps on the back of the world? This is a very important, energizing set of chats.
Absolutely. And if you look at it, and as you talked about it, Dr. T, relieved is one. Think about that. Enlightened, and hopefully after today, we will all be more enlightened as we share our special truth with each other. Healthy, mindful, and I think, all of these things, empowered, and I got this thing called You Got the Power. So every time I see power anywhere, it just does something for my soul. Right.
And Black people are a faithful people.
Right.
And blessed is right there near hopeful. Right. I think we're all thankful having gotten this far. And that makes it so tragic to get this far. Now is not the time to get infected.
Right. Well, absolutely. And normally, people talk about accidents happen when you get close to home. Mm-hmm. And because people let their guards down, this is not the time to let your guard down. And that's what we're talking about. But we need to maintain hopefulness, because hope is what keeps us moving forward, even when we don't see the end right now. But we know we're hopeful that things will work out for our good. Right.
Now, Mr. Mayor, we have 156 people in this webinar. And I think it's important for all of them to know that you're here represents your ambassadors, your front line, you're the early adopters. We want to mobilize the entire country. You're the first wave to come through to take on a leadership role to help save our community.
So I think we are about complete with the with the word cloud, and I want to just say that the dominant word remained hopeful, and so I'm appreciative that that's the spirit that we will commence our conversation. We'll commence our conversation with the spirit of hope. Now, one of the things that we want to do, because we know that there were so many people who have registered, and they have had some people had orientation last week. Some people are having their first orientation this week. And Dr. T, let's talk about, by the end of the training, what people need to be able to get from this thing.
Well, let me take a chance here and share my screen. Everybody out there, cross your fingers, will you? And then we're going to introduce you to our panel. And the panelists, I want you to be thinking about, what was your word and what were you thinking when you saw that cloud? But let's get to some of the brass tacks. Everybody wants to know what the expectations are. So you've seen the website where we have information to give you background information on everything about the initiative and the partners. And let me see here and make this thing work here. There we go. Here's the Center for Health Equity will be providing the formal training. This formal training is necessary for you to get your certificate. And guess what happens when you get that certificate? You get paid. And let's give another hand out here as the students teach me. Give some snaps to Shea Moisture. They
Absolutely.
put $1 million on the table to help recruit 1,000 barbershops and salons, and they will receive $1,000 each. Now, what's so important about that is a recognition that it is a recognition of showing you respect. Many of the shops have been hurt during the pandemic, and for a company to step up and say, we respect your time, here's an incentive, and I think it's a game changer. So this is a rolling enrollment. So let me tell you that. So if you know of barbershops and salons who haven't signed up yet, get them to sign up. Now the word is trickling out, as you know, Omar, in our community through the grapevine. Okay.
Absolutely.
It's coming out through the grapevine. And so one of the things that you'll be able to do immediately, because after this training tonight, you're ready to get started on what you need to do to start educating your community. And in our the webpage you're going to get, you'll get a link to our opening, and that's available right now. The other thing you're going to see is the modules, and I'll just do a very, very quick overview, and we're going to take you into some detail a little bit later in the show today. But the first module is how my barbershop salon became a COVID-19 education vaccination site. And you're going to meet Katrina Randolph, Mike Brown, and they're going to show you actually what happened in their shops to be able to deliver vaccinations. And you're going to meet some of the lead barbers around the country who are doing work, just outstanding work. And many of you out there have already started, and we want to get you on board as well. The second module is COVID-19 101. Let's come to some basic facts. And again, tonight we're going to answer your questions about these basic facts. So start getting them ready so that we can address not only the questions you may have as a barber stylist, but also what are you hearing from people sitting in your chair? What are you hearing from your family? Module 3, the colors of COVID-19, lessons from the front lines of vaccine hesitancy, vaccine access and hesitancy. And you can see there are core faculty. We have some of the top people in the country providing you with this information. It's information you can trust. Okay? We're pushing information, not pushing vaccine. We're pushing information. And Omar, what did you say when people have the right information, when they have knowledge? What did you say?
They naturally gravitate to take care of themselves.
There you go. They naturally gravitate to take care of themselves. Module 4, communicating information about COVID-19, straight talk with clients and media. As a result of this national initiative, you're going to get media coverage, and we want to help you deal with the media coverage. So far, I've been very impressed, Omar. The media coverage about the barbershops and COVID vaccinations have all been positive. That's amazing. Module 5 is training for collaboration and local clinical partners. Any barbershop or salon listening to me right now, if you want to have a vaccine clinic in your barbershop or salon, we have a clinical partner for you. We can help connect you to a clinical partner. You need information that's culturally tailored to your community. We have a link and a partnership with the National Association of County and City Health Officers. That will be your link right there in your locale. So these are the 5 modules that we would like for you to view, to assess, and that will be our evidence that you have completed the educational components. But one of the things that you'll do, and we'll walk you through this, is you will actually sign up in our online learning platform where all the modules are located. And we'll talk about that a little bit later in the show today. But at the end of the training, we want you to be able to identify where to receive COVID-19 vaccinations in your community and provide referrals to your clients. Secondly, to be able to list no less than 4 credible sources of COVID-19 vaccine and other information. And number 3, to utilize credible information to discuss COVID vaccines with your clients. Many of you have already met this. This is our validation and confirmation as you move forward. You're going to learn a lot more, but at minimum, we want you to know this. Now, one of the things that Shea Moisture wants to know is a verification of your activities out in the community. And these are simple. We need you to think, like right now, how you might schedule an event that you're holding at your barbershop or salon, partnering in the community where you are promoting an event, and therefore your event flyer and description, any news coverage, any photos and video of the event, social media posts, marketing, advertising, and then share whatever outcomes. And those outcomes, the good, the bad, and the ugly of the outcomes is important for us to know, because we're working with your colleagues all across the United States. Things are different in Michigan than they may be in Alabama. Am I right, Omar?
Absolutely. Absolutely.
So let me come out of sharing here, and let's have our panelists let's find out what's going through their minds.
Well, one of the things, Dr. T, thank you so much for giving us an overview about what is expected of the people who have joined us in this process. And you are a partner. We want you to know that each and every one of you, we are partners in saving our own lives. Now, let me bring forth a panel of what I would call individuals who have a heart for the people and knowledge to save the people. Dr. Harry Close, who is a dear friend of mine. He's a Tuskegee man, and I say that all the time because he was on the board of trustees at Tuskegee University. He heads up he's the president of the National Association of Black Morticians and Funeral Home Directors Association. He is a mortician, but he's also a preacher, and so he can do everything that you need. Dr. Close, it's wonderful having you hanging out with us.
Thank you so much.
Dr. Tuesday Cook, we probably have had more people demand that you stay on this panel every time. You are backed by popular demand. I want you to know that. And a surgeon, a person who truly speaks truth and truly love your people. Thank you for being here with us.
Thank you for inviting me again.
Absolutely. We got a new kid on the block, Mr. Tony Roberts. He's a master barber in Atlanta, Georgia. He's in the ATL, and they doing their thing in the basketball. So, I'm not going to say anything about, Milwaukee and nothing like that.
Don't start no trouble.
I'm not going to start no trouble. I'm not going to say, I said I wasn't going to say nothing about that. Tony Roberts is joining us today. Hey, Tony, how you doing?
I'm doing wonderfully. Thank you for having me on this panel. Super
Absolutely.
excited to be here.
Absolutely. Now, Clarence Jones, I've heard a lot about you, man, about Barbers Examiners Board. And so we want to really talk about the collaboration of barbers and stylists and how we can build that collaboration, not only in certain geographical locations, but nationwide. And so we're happy to have you join us today as well. Let me hear you. Can I hear you?
So we'll have our tech people see if Clarence is still in. I did see he was pinned up.
Yeah, he was pinned up. I don't know what happened.
Let's keep going. We'll cycle back.
Yeah, we'll cycle back. Aaron Perry was on with us before, and he's back again. He is a part of an organization that builds collaborations with barbers in I'm trying to think of the area you're in now, Aaron.
Madison, Wisconsin.
Madison, Wisconsin. And when you were talking about dealing with mental challenges that people have and having a vehicle to have those kinds of conversations, man, you really touch my heart. And so hopefully you will talk a little bit about what you're doing in terms of addressing the mental challenges that many of your clients have and in doing it in the shops. So that was really powerful. And of course, you met Reed Tuckson, who is the co-founder of Black Coalition Against COVID. And he does so many other things. And of course, you met Cameron Webb, Dr. Cameron Webb as well. So you kind of met everybody now. I know we have Waverly Willis. I guess he's with us as well. So we're going to make sure that we bring him in at some junctures as well. But I want to start with you, Tony Roberts. You don't know, you're the new kid on the block, and I'm starting with you, right?
What's your word, Tony?
My word is motivated. I'm super motivated. And I know I'm not supposed to add another, but I'm also excited to see this thing beginning to wane and come to an end. And in my particular line of work, being a barbershop owner, I talk to people all day long about the vaccination. My wife and I are both vaccinated, and I try to encourage others to do the same thing, especially my staff and the customers and the clients that come in.
You know, I want to kind of talk to you about what you're hearing, because I know that if we're going to really make a difference, we're going to have to really get to the core issues of where people hesitancy lie. And we don't need to equivocate or try to brush people off. We don't need to blame or shame. We need to truly answer those questions straight forth and forthright. What are the questions? What are the comments? What's the kind of discussions that you're having in the barbershops?
Well, I'm hearing a myriad of different things. I hear everything from I'm not getting the vaccine, and of course they always go back to the Tuskegee experiment. And I tell them we've come so far since then. Our country, our people, and that this is so very important for us to get back on track. I hear they just don't trust local government, national government, and it pains me to have to explain to them, hey, listen, this is about us becoming whole again as a people first, because we are affected more by this disease than any other race, seemingly. And I'm a diabetic myself, and I explain to people all the time that my concern was first and foremost for my health and then my family. I can't take care of my family if in fact I'm sick or gone. So I try to put that into the ears of people. I hear people just really concerned about the content of what they're putting in their body, and I explain to them this is a very personal choice, and I understand. I don't guilt shame. I don't shame them, or I don't cause them to feel any kind of way about it. I just want them to hear proper information. I think that's my biggest concern.
You know, well we have Dr. Webb, we have you and Dr. Cook here to kind of respond to some of those concerns. If you all would open your mics and let's see if we can kind of go through them. Now, the trust issue, let me begin by saying the trust issue in the context of the Tuskegee study. And we know that comes up a lot. We've heard it multiple times. Let me first of all give you where I stand on this. Absolutely. I'm the former mayor of Tuskegee, Alabama.
Absolutely.
I live in Tuskegee currently. I'm broadcasting from Tuskegee right now. The context of the Tuskegee syphilis study, or the National United States Public Health study that was done in Tuskegee, right, is different from COVID-19 and the vaccine. You see, the difference is this, and let me make it unequivocally clear to you, that the remedy, the cure, the vaccine, if you will, for syphilis was denied the people in the study. Right now, we're talking about people providing you with the vaccine. That is the difference.
Right.
And so when you use Tuskegee to not take the vaccine, you are doing what the government did to the people in Tuskegee, to yourself.
Exactly.
And so what I'm saying to you, don't use that out of context.
Right.
This is very different. Had they given the men the penicillin at that time, the vaccine, let's just use that terminology, then they would have done them a service. And so not to take the vaccine now does you a disservice. And so let's make sure that we are clear on that. Now let me bring you, Cameron, and Dr. Cook in to talk about some things in terms of the makeup of the vaccine and how it is not harmful. Let's talk about the efficacy and safety of the vaccine so that people can get that information directly from you guys who are on the front line.
Absolutely. Well, I'm happy to go first because I learned last time around not to go after Dr. Tuesday Cook. Some things
Larry
You a
will get
smart
you
man. You a
everywhere.
smart
Listen,
man.
fool me one time, shame on you. I'll start here. Mayor Neal, you hit the nail on the head with regard to Tuskegee, but I think at the core of this is trust, right? And you had a 40-year study where people just didn't know that they were being taken advantage of.
Mhm.
And just as I said in jest, fool me one time, shame on you. I think that's kind of the mentality that a lot of people have. They say that, through that study over those 40 years, even though the dynamics may be a little bit different, the government was the perpetrator of harm. What I would say is that this situation, for the reasons that Mayor Neal mentioned, is very different technically. But even in terms of the oversight of this entire endeavor, the scientists who were helping to create the vaccines, there were Black people involved. The scientists involved in approving the vaccines, there were Black people involved. In the studies that were conducted, there were Black people involved. Ultimately, at every step along the way, representation matters. And it's the reason why we're able to trust this a little bit more. Now, I'll give you another number. We've got about 178 million people in this country who've received at least one dose of this vaccine. 178 million people. And so when people say it's experimental, I'm going to just say that number one more time. 178 million people have had this vaccine. We've been tracking the effects. This vaccine has been safe and it's been effective. And that's the reason why so many people have had it. But let's be clear. That's 9.3 million Black people. That's 61 million white people. Okay. That's the difference that I want to point out to you. All receiving the same vaccine. And they're receiving these vaccines because they stop people from being hospitalized and they stop people from dying. The effectiveness is very high. And I'll end here and then pass it to Dr. Cook. When people ask, well, what is in it? What am I putting in my body? Because yes, if somebody comes to you with a vial of who knows what and says, I want to stick this in your arm, you must have questions. As a smart human being, you should have some questions, right? And so when you say, well, what are you sticking in my arm? I got the Pfizer vaccine. And before I got that vaccine, I did my research. And I said, well, what's in it? And it's 4 things. The first is the mRNA, the messenger RNA. That's what actually teaches your body how to fight against a COVID infection. Really what it is just a signal that tells your body to make a protein, which is the spike on the virus itself. And then your body says, oh, that's a bad thing. If I see that spike again, we're going to fight, right? That's what the spike protein is. It's not putting the whole virus in your body. It's just saying, hey, this thing that's on a COVID virus, just this spike, if you see that anywhere, it's time to fight. That's what the messenger RNA teaches you. That's the first ingredient. Second ingredient is lipids or fats, if you will. Those fats create a layer around the messenger RNA because messenger RNA breaks down so incredibly fast in the body, it would never reach the cell to do its job if it weren't covered by that lipid layer. And that should tell you right there when people say, oh, it's going to be in your body for a long time. It won't. We actually had to create a lipid layer around it because it breaks down too fast otherwise, right? So that's the second thing that's in it. Is that fat layer. The third is salts, because your body has a natural pH, that's your acid-base balance, that would also break down this messenger RNA and the lipids really fast if you didn't stabilize it with some salts. So we got messenger RNA, a fat layer around it to stabilize it to get to the cell, some salts to keep it stable through your body's natural pH. And the fourth thing is sugars, because we store this at cold temperatures and those fats stick together if you don't have some sugars in there as well. Messenger RNA, a fat layer, salts, and sugars. Those are the ingredients, right? And so people say, oh, there's all these other things. There's not. It's actually pretty simple when we think about the real ingredients. And that's what's so incredible about this technology. Just with that combination, we're able to protect you fully against the worst that this virus can do. And so that's why I say, it's so important to actually know what you're putting into your body. And when you do, that helps people realize that it's safe. I'm going to pass to Dr. Cook for the real wisdom.
Dr. Cook,
There's actually nothing for me to say at this point. You have covered it excellently. I'm not really sure I have much to add.
Dr. Cook, I want you to do this then.
Yes.
Take us through your journey.
And give us your word.
You want to give you your word, but take us through your journey, because you didn't start out. You are one of the top surgeons in this country, but you didn't start out you started out with hesitancy about the vaccine, right? So I want you to take us through your journey and to your point of acceptance of the vaccine.
Okay. Well, I can. I am a physician. I trained at Howard for medical school and for residency, and I went to fellowship in Pennsylvania and did a minimally invasive and bariatric surgery fellowship there, and came back to the DC metropolitan area to practice. And I work taking care of Black and Brown Latinx patients. Those are the majority of patients that I see throughout the couple of decades in my career. And I am my patients. So who they see is who they get. Who they're like people who are in my family, which is why I have a pretty good rapport with my patients. And so I understand the journey that they go through with regards to believing the medical system and wanting to be a part of the medical system and the kind of care that they receive from the medical system. And so from my standpoint, in terms of getting care, I was worried about the vaccine. I had seen so many people die in the hospitals. And, as a bariatric surgeon, patients with obesity have extremely high risk. Between the start of the pandemic and November 2020, a third of the 900,000 COVID-19 hospitalizations were secondary to obesity. So, my patients were at the highest risk. And yet still I was nervous about getting the vaccine. And so I had to really, buckle down and read. And the reason I was nervous is because I'm a Black woman that lives in the United States. And so I understand, medical apartheid. I understand what has happened historically. I understand what happens currently. And I see it regularly, and I have to, try my best from my standpoint to thwart it and step in and say something when I see something being done by a colleague or for one patient and not for another. And so just seeing those things even now made me worry that this was not something that I should receive. The fact that it had been made so fast, and the fact that, it was something that I had not heard of before, it made me have to really go along a journey of studying and reading research articles and attending webinars and seminars and talking to my colleagues, because I also have physician colleagues who are Black, anesthesiologists, surgeons, internal medicine doctors, pediatricians who were also worried and kind of hesitant about receiving the vaccine as well. And we spoke to each other whenever we found articles. We shared that with each other. We prayed with each other and for each other, and so it kind of, we kind of did everything that we possibly could to get to a space where we were not only comfortable in feeling like this was the right move for us, but we were educated. And for me, that's the biggest part. I try to educate my patients about all of their medical problems, their comorbidities, diabetes, their high blood pressure, their high cholesterol, the things that go along with obesity, their sleep apnea. Because what an educated patient, an educated person, is a person who can make an informed decision. So just like Dr. Webb was saying, we're not here to push any vaccines or push people to say you have to get this, but rather to educate people. And so we got to a place, my physician colleagues, my patients, and I, we got to a place of comfort and education where we understood that this was the right thing to do to decrease the number of deaths and the number of hospitalizations secondary to COVID-19 infection. And I will say that I did not speak to any of my patients about getting vaccinated until I had become vaccinated myself, until I had read and researched and prayed and went along my journey and then got vaccinated. That was the only time at which I then started to say, okay, here's information, here's, something perhaps, you can understand. If you don't understand it, take this, read it, come back to me, let's talk about it. So that, because I could never push my patients to do something that I wouldn't do for myself. And so that for the most part encompasses my journey with regards to getting vaccinated. I'm happy that I did it. I'm happy that people are getting vaccinated, though the discrepancies with us versus them is still quite large. Again, I have to make sure I talk about obesity. As a bariatric surgeon, obesity it disproportionately impacts some racial and ethnic minority groups, meaning we suffer from a higher rate of obesity. We suffer from higher rates of diabetes and high cholesterol, uncontrolled hypertension, things that go along with it. And so we need to make sure that we take care of ourselves and our health in general. And I think becoming educated about the vaccine and making it an informed choice is to our benefit.
Thank you so much. Now, give me your word, Dr. Cook.
So my word, the word I typed in there was that big old word hopeful, because I was just so very happy that our numbers are increasing. We still lag behind places like Kansas and Wyoming and Utah and Maryland. And I'm trying to believe that we need to make sure that we go higher up on that list. However, I'm a bit cautiously optimistic, because, hesitancy it's still real. It's improved. Education is improved as well, but it's real, and people who are not vaccinated are still exposing themselves to becoming infected. And I'm hoping to not see a rise in cases of variants. I'm hoping to not see a rise in hospitalizations again, because people are like, oh, it's over. I heard about it. I read about it. This is great. Now I can go for 4th of July to, the picnic. And then, you get it from Pookie, you give it to grandma, and people really need to understand that, it's better. It absolutely is better. There's my hopeful. But we need to make sure that it continues to get better. The stats that Dr. Webb spoke about are real stats. Numbers don't lie. So we need to ensure that our communities are vaccinated. Our communities, if you're wearing a mask, great. If you're not wearing a mask, okay. CDC says what it says, but you have to make sure that you're protecting yourself in the way that you can, because your former Manuel said, you have the power. Your mom did it for you when you were young, for you to get into school. Now it's really your responsibility to do it for yourself.
Omar, Dr. Cook, you're a physician. How does it feel to have barbers and stylists as partners in this fight?
Well, it feels great. Let me tell you, because as a Black woman, I'm not going anywhere without my stylist. You need to come on over. I mean, during the pandemic, my house was shut off, but I still had to send texts and say, okay, what moisturizer do I need to use? All right, how do I cut my ends? What blow dry can I get to kind of, tease it out? And yeah, we don't play around without consulting our stylist. And then when we find our stylist, and it's just like, many men in my family and my friends, when you find your barber, and I used, don't tell my husband, I used to date a barber. So I understand the importance of people in your chair. But when we find our barber, we find our stylist, we find our hair salon, that's it. That's it. My friend used to, after medical school, she moved back to New York, and she drove down here every weekend to go to the salon. I would meet her. We go to the salon. So it's not a joke. So it's very important, the role that barbers and stylists and your beautician that they have in your community. It's very important. Their information is far and wide reaching. So it's important that we provide them with the right information. So when people are going to see them, people who won't even go to the doctor once a year, but they're going to their hairstylist. So we got to make sure that when they go to the place that they deem important, that they are getting the right information. So I think that this is a wonderful, wonderful venture, and I'm happy to be a part of it.
Thank you so much, Dr. Cook. Let me encourage those of you who are out there, all of our barbers and stylists, to put in your questions or comments, the things that you are hearing. We want to kind of curate those things, and we want to try to answer any questions that you may have personally, or that you want to get information back to your clients. We want to make sure that you have that information when we leave here today. Let me go to Dr. Harry Close. Dr. Close, it's you see the failings of society. You see when things don't go well, particularly as it relates to pandemics, where the number of people who die from COVID-19, over 600,000 people have succumbed to this dreadful virus. And it has also not escaped your colleagues. You told us that over 300 of your colleagues that are funeral home directors have succumbed to COVID-19. I want you to talk a little bit about it from your angle, being a person who's in the funeral home industry.
First of all, let me say good evening. And I'm like Dr. Webb. I have to come behind Dr. Cook. So I really, but first of all, let me say to the stylists and barbers, I am honored to be with you tonight because you are the country club of our community. And the funeral directors and the barbers and the stylists, we have a relationship because I know eventually one of you are going to come into my facility to assist the family through that process. Yes, the reality that Dr. Webb and Dr. Tuckson, you know, I've been dealing with the media and telling them where they can get the information. The African-American funeral homes and the Black and brown funeral directors have not only been impacted with serving families, we've lost lives. And I'm just giving you the numbers for the funeral directors. I'm not even talking about their staff. And then the media asks me, well, how can I find the numbers? I said, well, the Information Act, go Social Security, go to every state vital records, and they will have to provide that because the occupation has to be on it. You know, even the thrill where people thought that funeral directors were excited about this pandemic. And we were like, we're losing our lives by putting our lives online, just like the barbers and the stylists. You were putting your life for those that were going to someone's house, doing someone's hair, cutting someone's hair outside. You were putting yourself at risk. And I know you were impacted as well, because I know a lot of stylists and barbers I have served who lost their life to COVID. COVID-19, we know is still real. But I want to say that we have to make sure that our people that we serve in our community is the funeral director, it's the barber, it's the stylist, it's the preacher who have impact, and no disrespect to all the positions. Funeral directors.
I'm on a zone, son.
Funeral directors deal with everyone in the community, for those that believe, don't believe. And when funeral directors are losing their lives and their staff to serve people during this time, it's really overwhelming. I will ask, since I have them on this show, to let Dr. Webb and Dr. Tuckson know that in the last 6 months, I know the Biden-Harris administration is new, got 6 months in. I need your assistance. We've been trying to get the scientists to come talk to us. People forget funeral directors are scientists, and we deal with the human body, and this body is a health issue when it stops functioning. So hopefully on the sidebar, Mr. Mayor and Dr. Thompson, you can help me connect with them to assist us to educate my members. And the idea is, I was taking pictures. I want to say to barbers, this excellent woman, and Dr. Thomas and Neil, I look forward to trying to develop something for us with the funeral directors, because we need this as well. I have many of my members that had the outlook that Dr. Cook, who did not want to take it until somebody died on their staff. And then funeral homes were closed for 3 to 4 weeks because then it became a hot spot. So then you couldn't even serve the people that you were trying to serve. So I think this venue is excellent, and we need to take it into every venue. And Dr. Tuckson, I think funeral directors with doctors and nurses also need to have the funeral directors involved, because we're all in the same thing. For that death certificate never says the actual cause. I happen to be sitting on the steering committee with FEMA on the funeral assistance reimbursement. That's one federal agency that reached out to us, and we're sitting on the steering committee. And if that death certificate does not say COVID-19, you will not be compensated at $9,000. I know that Senator Schumer and Representative AOC just got changed for New York, really. But if they have a physician that will write a letter saying that the death was related to that factor. So we already know that for those of us who deal with the health issue side, and funeral directors are the last stage, the death certificate doesn't always reflect what the person died from. And that means that same person sitting in the chair, the barber in the salon, could be affected and you don't even know. So it's very important for all of us to work together and to educate our community, because we are the last line of defense. All of us who serve in a public factor, especially that look to brown and black people. We need to educate ourselves by making sure we have the factual information so that we can educate. And I really appreciate being an opportunity on this particular show, because it really, I'm going to take Dr. Webb. I wrote down those 4 points. I do a monthly update to the National Funeral Directors and Mortician Association, and I will be putting those points and reinforcing what Dr. Cook just said, to educate our members that what we do for a living is real. And what you guys do I used to have a lot of hair, Mr. Mayor. My barber still makes it look like really good. I got a little fuzz sometimes, and that's all I'm going to say.
Thank you so much.
I was just going to say to Dr. Close that you're at that end of the line as you were describing, but it's also a teachable moment, is it not? The time that you're spending with the family at that moment.
Very much so. Matter of fact, I have 3 COVID cases that we just received today. And we emphasize, still got to put that mask on. The protocols, I'm not changing from the protocols. And like the physicians know, you might be exposed to it, but it could be on your clothes. It's an airborne virus. And, my thing is we must not put our guards down. And I think listening to our colleagues, I have some colleagues that I'm serving at another organization that's from the majority community, and they thought it was a joke until it finally got to their community in the Midwest and the Deep South. And now they realize this thing is not a joke. Right. And it's mutating, but you got to have take that vaccine. And, Dr. Cook, I'm only using you because you were being transparent. A lot of people didn't want to take it. And then until someone started dying, and I commend both of the physicians, all 3 physicians on that were being transparent, because as a patient, I want to see the transparency of my physician. And it's like when I'm getting my hair cut, I still go every 2 weeks. I respect my barber because he gives me information that's always educating, because and those barbers and stylists, you guys are a wealth of information. And
yeah.
So
I forgot that you were a preacher too. Golly. That's what happened. It's my fault. I should have known. It wasn't your fault. Dr. Thomas brought you back in. You were trying to exit. We love you, man. That's a wonderful thing. Let me go here. Again, we want to make sure that we're getting your questions in, because what we want to do is answer those questions. Now, Aaron Perry, you have really developed coalitions for barbers. I want to talk a little bit about what you do and how do you see what you do in your organization, what it's doing and how it interface with this conversation.
Yeah, thank you guys for, and ladies and gentlemen, for extending that invitation to me. I can tell you, we open up 2 men's health clinics and barbershops, and so these are going very well. But a little personal note, I've been living with diabetes for 27 years. I actually am the world's first African-American diabetic to complete the Ironman triathlon. And so I've really focused on not just walking the walk, but talking the talk and vice versa. But I can tell you, the area that we have gained the most traction is tapping into that relationship that the barbers have with their clients. In the evenings, I look at my data. If there's only 10 blood pressure screenings that happen to the day, the very next day I'm talking to the barbers. Hey, tell these guys this center is here. They need to use it. All of a sudden, we got 45 blood pressure screenings. And so we tapped into that relationship. The other thing that I want to make sure I focus on is we know that currently we are dealing with 3 epidemics: COVID-19, health disparities, and racial tension. We know that. And so those tend to drive messages. And so we tend to focus kind of, when I think about that deficit messaging, focusing on what's wrong, we tend to move away from that. And we're more focused on that asset-based thinking. What's going well? What is possible? And as we tend to focus on that, we steer those conversations away from, I am not getting vaccinated and this is why, but we start to focus on that asset-based thinking, everything that's going well, what is possible. And suddenly we did a vaccine clinic. We had 114 guys come through. Now, I am going to have to tap into Dr. Webb, Dr. Tutson, and Dr. Thomas, because the CDC came in and they told us that we cannot pay for provide haircuts for COVID testing anymore, for the shots anymore. And so if someone can look into that, because we were having some major success offering those free haircuts in exchange to get that vaccination, and they said no more. And so I'm not sure what that's about, but these are the kind of things that we're doing. And then the last thing I'll share real quick is that we also, we do a lot of surveys and focus groups, and we really listen to what these men are stating they want. And based on that, we try to provide that. And the number one thing that really came full circle is we're now offering teletherapy, because the mental health issue was so prevalent. Guys are struggling with that so much. We've all of a sudden tapped into that childhood trauma that these men have been living with. And now we're coming full circle with it. And so these are the things that we're doing from the barbershop.
I think, Omar, I think it's amazing for the government to have an inside look at this asset in the community. It's always been there, and now we're lifting it up to address not only COVID, but as Aaron's talking about, addressing mental health issues in our community.
Yeah, and thanks, Aaron, for laying all of that out, and much kudos to the success that you and your organization have had in really, addressing this issue and getting people vaccinated. That's incredible. And Dr. Close, I come back to you only to tell you this, that Dr. Thomas and I are working right now on getting a forum for the morticians and funeral home directors. So we are working on that right now.
We receive it.
Absolutely. Absolutely. All right. So let's go to Clarence Jones. Clarence, you are Barber Examiners Board, and so I want to see how do you see what's happening, and what have we missed? I mean, coming behind Dr. Cook and Dr. Webb and all of these other people. I know that's hard, but you the last one, so you really got to knock it. That you what we call the what's the man that comes in when all the bases are loaded?
The pitch hitter or whatever. Okay,
but no. You the cleanup batter.
Yeah,
that's the cleanup batter. Okay. Is that right? You the cleanup batter. So we need you to clean this thing up and hit a home run and knock us home.
Oh, so that's a lot of expectations for me. But good evening, everybody. And Dr. Thomas, I want to thank you for the invitation to being here. The word that I used was blessed. And why I used the word blessed was because, first of all, I didn't get COVID. And secondly, I work in a city where we have men and women who are involved in the barbering profession who really, really wanted to help. Now, I come in to this meeting with from two different perspectives. Number one, I am a public member of the Barbers Board, which means that I don't cut hair, but I come from a public health perspective. And so whenever I'm at the Barber Board, I want to make sure that our community is safe and that our community is getting the kind of care that it needs. I'm also a person that's called I'm the community health strategist for a group that's called the Human Partnership. And we are a coalition of organizations that look at our community and figure out ways in which we might be able to help them. And so it's been really important for us to let our barbers know that we are still there for them. As a member of the Barber Board, we got the instructions. We had to shut the shops down, and that created a huge impact on the barbers. And as somebody said, a lot of us couldn't get our hair cut, but it was very important for us to be able to provide them with the kind of information that we needed. Even though it was kind of tough information, but we still had to tell them that this is about protecting the public. And one of the things that I think is so important in terms of this whole process, at least from my perspective, is that as a community member, it's important for us to understand how this virus is affecting us and how do we use trusted messengers within our community to pass that information on. I always say this: barbers are one of the one groups that I know of that can touch a man intimately in public. And when you can touch a man intimately in public, that means that in many cases, they'll tell you everything. They'll tell you things they won't tell their partner.
My.
And so part of what But part of what our role is to do, and as others have said, is to provide them with the education and information so that they can give people true information so that they can make an informed decision. One of the challenges for us really is that I'm not trying to run anybody else's life because I can hardly run my own life. Okay. But I do know that as a community member, I do know that as a healthcare professional, it's important for me to be very, very clear about what my role and my expectations are. And so when I approach our community, and I know we have some of our Minnesota barbers here, and when I approach my community, I have to tell them what my bottom line is. My bottom line is healthy men, healthy families, healthy communities. And I will utilize, I said utilize, I will never use anybody, but I will utilize people to help us to get that message across. And so one of the things, I want to go back to my first statement, one of the reasons why I feel like I'm blessed, we got a lot of barbers in Minnesota that are asking, what can we do?
Well, let me say this, man. I want to thank you for what you are doing, and with the all of the organizations that we have represented here, all of the physicians and people in different areas, the funeral home directors. Thank you all for all that you do, both seen and unseen. I think it's important that we say thank you, because you don't have to do it. This is a critical time, and we don't need to take anyone for granted during this time. Now I want to move to a poll now, because I want to kind of get a feel for how many of our barbers and stylists have either taken the vaccine or have not taken the vaccine or plan to take the vaccine at some point. So if we can put the poll up.
Let's put that poll up. And let me just say that first question. And let me just say to the audience, we had a little technical challenges up front. We'll run a little bit over. But let's go ahead, Cameron, and the other Cameron, and put the poll up. And it's an effort to see what you're seeing in the chair when you think about your customer base, when you think about your clients. And you can go ahead and take that screen. And while they're doing that, Omar, I was just impressed with the fact that even our panelists and our scientists, our physicians, had a journey. Hesitancy does not mean never. And so treating people with dignity and respect, with regardless of where they are in that journey, is how you help them turn the corner. And we're going to take your questions in the chat box as well. And if my team can bring that poll up, the other thing we want to do is to actually take this audience into a salon that was turned into a clinic. Okay, we've got some responses here, and the way the question was, Omar, when you think of your clients, what proportion of your adult clients have gotten at least one dose of a COVID vaccine? So Dr. Webb and Dr. Tuckson, take a look here. Not bad. Not bad, but we're still at that last mile. 15% say only a few, and it will be variation around the country. And I think that's one of the keys to this initiative, that it is national, and we'll be able to tailor our interventions with the barbers based on where they are. So the poll's still open. Keep voting. Go ahead,
Stephen, as you think about it, and I think the point you're making is important, that the national data really doesn't matter a whole lot. It's where you live that's the issue. And I hope that people will continue to understand that that as these variants expand, if our community remains as lowly vaccinated, as inadequately vaccinated as we are now, there's only one thing that will happen, and that is that this disease will stay in our community and cycle and circle over and over again over the years. Remember, as these cities open up and people are moving freely about, you have no idea who that person is that's walking around you without their mask. And you can't trust anybody, unfortunately, these days. So my point only is that as you look at these numbers, and thank God that some of these numbers are on the way up, we hope, and that because you're going to do what you do and help people make intelligent and informed decisions. But think about what the alternative is if we don't. And this is going to become primarily a disease of Black folks and crazy white wing Republicans. So let's just be clear. You cannot say that you love Black people and still be unvaccinated and walk around without a mask. You can't have it both ways. If you have an undying love for Black people, then you're going to have to decide one way or the other. But look, folks, if your people that are coming around you are strong, militant, whatever, they're full of vim and vigor about how angry they are with white society and so forth and so on, everything is a conspiracy and they're out to get us. If you're going to do all of that, at least don't be a vector of killing your own people. The white folks are good enough at that. Okay, so let's just make sure that we are responsible for each other. The last thing I would just say as this poll finishes up, Stephen, is there are a lot of fundamental questions that people have. What we are trying to emphasize to you and your customers, it's okay to have questions. Ask questions, but please ask the question to people who have some idea of what they are talking about. People like Cam Webb and myself and Dr. Cook, we spend a lot of time in our life preparing ourselves to serve our people. We spend a lot of time with our head in the books. We ain't playing. We're serious people. We study these things and we do love our people. So please ask the questions you need to ask. So we're going to keep looking at the chat, and any question that you have, we're ready to answer it to the best of our ability. If we don't know the answer, we'll tell you.
Dr. Cook, you have a statement you want to make. Unmute yourself. Go ahead.
Yes, I did. There are actually 2 points. The first one is that people are discussing my transparency, and I want to make it clear the reason I'm transparent is because I have had colleagues who are not us, who are physicians as well, say things that sometimes seem disparaging about why we don't want to get the vaccine. And I have to make sure they understand that it's not a lack of understanding always. It's not even a lack of education always, in terms of being able to understand the information. But sometimes it does have to do with the trust and transparency of the medical community historically with Black people. I then have to make sure that they understand what Black bodies were used for throughout history, and why it makes sense that people are a bit worried and how they may need to address them and their fears, and that they may need to listen in order to give the right information and the right education to that person at that time. I want to make sure that people understand that people who have multiple degrees also can be worried about treatment in this country. And so that's one of the reasons I think I'm so transparent, because for some reason people just assume that if you don't want something that they're offering you, it's because you don't know. And sometimes we don't know, but in some cases we know, but we also know a little bit something else. And so we have to make sure that we're addressing concerns at every level and from every aspect.
I know Reed is chopping at the bit to say something.
I'm so sorry. There was a question.
I just want to make sure, as you all are moderators leading us through, we've got about 5 or 6 great questions. Can we, when we're just standing by, Cam and I and Dr. Cook, we want to hit these questions quick and fast so everybody kind of gets the answers to these.
Okay. All right. So let's do this. What we're about to do now, let's go to a video first. And then when we come back, let's go and we'll kind of curate the questions and to give me a chance to look at them as well. What about that? All right.
Okay. So what we're going to do is actually take you into one of our salons. You're going to meet Katrina and literally see how she transformed her salon into a COVID-19 vaccine clinic. Take it to the beginning and roll video. Go ahead and hit play, my friend. Shots at the shop, and today we're at Katrina's Trey Shades Hair Studio in Capitol Heights, Maryland, which has been amazing.
My favorite part is saving lives, seeing people get vaccinated, because a lot of people are hesitant to get vaccinated. So if I can advocate and encourage them, I'm excited to do so.
A lot of people just don't trust the system. So we have to take the time to answer their questions. And what better place to do that than in a place they already trust?
They can dispel some myths and misinformation that's out there. And then they can refer them to others with, more specific questions.
I've honestly seen about 25 to 30 of my clients go from, no, I'm not getting that vaccine, to sure, I'll get vaccinated or show up at your clinic on Monday.
I got my vaccination. I was comfortable with coming here. I actually feel comfortable here than I would at a normal clinic.
I like it because I know this place is not like it's not strange or anything.
You truly are, barbers and stylists, a trusted voice in the community. And we want to tap into your expertise and be a good community partner.
It's just for us to be knowledgeable in these health disparities so that we can have conversations behind our chair, because I believe that we're more than just a hairstylist. We're touching people just like doctors and nurses do.
Any barbershop that wants to hold a vaccine clinic in their place of business will find you a clinical partner.
So we can bring in all the clinical expertise.
I say just do it. Just work on saving lives, keep advocating for the community, bringing more people in. And I do believe that having a vaccine clinic at a salon is well worth it.
It worked here at Trey Shades, and it could work in your barbershop or beauty salon as well.
Yes, son, you're fully vaccinated. It was a great day.
All right, give Katrina some snaps.
Absolutely.
And congratulate her. And you
Absolutely.
know what was really interesting, and Aaron, I'm thinking about what you do with the Black Men Who Run. We invited people to a party and some food and a cookout, and a clinic popped out. And so it's the relationship that they come for and the time that's taken to explain whatever question they may have. And now we have some questions in our own chat.
Right. Let's go to and take a few questions. And Regina asked the question, should I make masks optional in my salon? And Cameron, you and Dr. Cook and Reed, all of you all can kind of chime in on that.
Well, I would just start with the guidelines that we have, right? So for folks who are fully vaccinated, it's okay for folks who are fully vaccinated to be in indoor spaces and to not wear masks. For folks who aren't vaccinated, it's not okay because they run the risk of spreading COVID. And if you don't have a mechanism in place where you're having some way of knowing who's vaccinated and who's not, and that does make it challenging. It becomes kind of the honor system. I know a lot of shops that are, still encouraging folks to wear masks while they're, in the shop. And then when they're in the chair, they can take it off. And others, if they feel like, hey, if they have a sign that's clearly posted, which a lot of shops have done, and they're just saying, if you've been vaccinated, you can be masked off. Otherwise, please keep a mask on to protect each other so that we can keep the shop open. I know that a lot of you know this from your experiences early on in the pandemic. There's nothing worse for business than having to shut down for a couple of weeks because of COVID cases across the shop. And I've seen that in my community, a couple of shops where a couple of barbers got COVID, and then it's just, people feel less safe going there. You don't want those problems. And so it's really important to make sure that you're doing things to protect yourselves, because we need you. We talk about saving lives. I was about to do an interview on the Breakfast Club. If my barber didn't fit me in that day, it would have been over. So y'all have a critical service that you're doing in our communities. We need you. And so remember, you're protecting yourselves as well as protecting our community. So I would say, always err on the side of caution there.
Okay. All right. Let me ask.
Omar, we can help make sure they have masks for any client that comes in that doesn't have one or needs a new one, and help them get those resources as well.
Okay.
We
who will
provide-
say? Okay. Go ahead. Go ahead, Tony.
That's exactly what we do at our shop. We still require masks, but when you're in the chair, you don't have to wear one. And then we provide masks for our clients as well. Absolutely. It's absolutely important that we continue to protect ourselves and protect our clients.
Mm-hmm.
Mm-hmm. All right, let me ask the question. Did somebody was saying something? Okay.
Pull another question out of the
okay.
Let
me try to see what Craig is asking. Craig asked the question: if you had your first shot and missed your second shot, do you have to start out the cycle all over again?
So the short answer to that is it depends on the timing. You've got 42 days. So from the first shot to the second shot, that's what the data tells us. So you can, in 42 days, for those of us doing the math, that's 6 weeks. So for the Pfizer vaccine, for instance, you're supposed to get the first shot on day 1, 3 weeks later, come back for the second shot. But if you miss that, you actually have 3 more weeks where you can come back and still be vaccinated and it still worked just fine. Now, the thing is, after 42 days, you can still get vaccinated and with the second shot, and it may work. It's just we don't have science that tells us that it does, right? I don't know that folks would necessarily encourage you to start all over again. I think the reality is that you would take that second shot and we would say, we think you might be protected, but that's where we don't have the science backing us up anymore. And that's, I'll tell you, there's a tremendous amount of relief that I have as a physician, that I have as a community member who's sharing information, because I'm consistent. Everything that I recommend is rooted in science. There's a paper somewhere that I can point to and say, I'm telling you this because I've seen numbers where thousands of people were evaluated. That's the only reason this is my recommendation. So I can tell you, you can get that second shot up to day 42. If it's day 43, I can't tell you that it's going to work quite as well. But if it's day 42 or before, right, then you're good to go. So it depends on the timing. But I would say no matter what, make sure you go get that second shot. We haven't talked about variants yet on this call, but you're probably hearing in the news this Delta variant. It's the one that was causing all those problems in India. It's the one that's become the dominant strain in the United Kingdom. Over 90% of the cases here in the US, it was 2.7% of the cases at the end of May. By June 5th, it was 9.9% of the cases. And by June 19th, just 2 weeks later, it was 20% of the cases. This variant is spreading so quickly, it's becoming the dominant strain. And we know that if you've had 1 shot, you're only about 30% protected. But if you've had 2 shots, you're about 90% protected.
And Omar, make sure also, as we add on to that terrific answer, the people that we are seeing hospitalized in places like Michigan and other places, but the people that we are seeing hospitalized, those are people who are unvaccinated. We are not seeing anybody hospitalized or dying who have been vaccinated. Understand how different.
That's true.
This is an overwhelming observation over thousands and thousands and thousands and thousands of lives. So let's just be really, really clear.
And if you get that first shot, Omar, in the barbershop, and the second one can come from the CVS or another location, just keep your card and take that with you, and the medical professionals will know exactly what vaccine to give you for that second shot.
Mm-hmm. Let's do this this next question. People don't understand how the vaccine affects your DNA. Can you discuss for the vaccine effects on your DNA, or if there's any effect?
I've also heard that question.
Yeah.
This is one of my favorites because I what I love about barbershop talk is that I'm a huge hoops guy. I love hoops. I love getting into those debates in the barbershop. It's one of my favorite things. You know, the who's the greatest, LeBron or Michael Jordan. And I was at a shop in Chicago just yesterday, and I was telling the barber, I said, if somebody walked into your shop and they're sitting here and y'all are talking about basketball, and he says, Michael Jordan won 3 rings, you would be like, nah, he won 6 rings. They'd be like, no, 6 rings. And then everybody else would be like, 6 rings, bro, you're tripping, get out of the shop, right? So here's one of those things. When people talk about the vaccine changing your DNA, it's like somebody who's saying Michael Jordan only won 3 rings. It's just wrong, right? There's no way to support it. It's just false information. The vaccines never go into the part of the cell that contains DNA. They cannot function from a science perspective. There's no way for these vaccines to affect your DNA because they never enter the nucleus. The RNA harnesses a different apparatus in the cell that creates proteins. So it doesn't have the ability to impact your DNA. It's not possible, right? So it's just false. It's as wrong as saying Michael Jordan only won 3 rings. And that's what's so great about an initiative like this. Barbers and stylists, you all call out bad information all the time. That's what shop talk is, right? It's people saying, no, that's not right. And that's what we want to do through an initiative like this, is make sure that you're in a position to say, no, this doesn't mess with your DNA. It doesn't even come close to your DNA. There's no way for it to do that. That's just false.
Okay, let's pull this from Brenda. I've had a lot of female clients asked about the effects of vaccines on women's bodies, specifically many of them having experienced unusual menstrual cycles directly after the vaccine. How could I best answer that?
So I'll take this one. I actually answered it in the chat, and I actually put some links to the CDC and the American College of Obstetrics and Gynecology, some of the most recent information that they have, and they've been saying this from a while back, but it does not generally change menstrual cycles. It doesn't affect, ovarian function, egg release, follicle formation. It doesn't do any of that. And so there have been a lot of questions about fertility as well. Actually, I have twin goddaughters who are both 14, and they just texted me 2 nights ago because they want to go get vaccinated, but they're worried about fertility. Now, first of all, I was like, why worry about fertility? But secondly, I was like, okay, it does not affect fertility. One of my friends, who's like one of the smartest people that I know, before any of this information came out, she was pregnant with her 3rd child, and she is triple boarded. And she got vaccinated while she was pregnant. Now, the data came out that it is safe. 3 of the big governing bodies with regards to reproduction and fertility and obstetrics and babies, they all agree, to CDC, ACOG, and the people who are the heads for maternal fetal medicine doctors, they all agree that it is safe to be vaccinated. Lactating mothers, women of childbearing age, and it should be offered to women who are pregnant. And so more data is coming out with regards to what we see as time goes on, because, again, we try to base what we say on data, just like Dr. Webb mentioned, but it is safe for women to get the vaccine. If some changes occur, you may count that as an outlier, again, because there are millions of people who have gotten it. And so, the results are pretty clear.
Okay. All right. So let's do this. I want to show a culturally tailored video now, if we can get that up, and show how we are able to take our uniqueness, Dr. Tuckson. You know how we got that swag, right? right, and show how we are able to take our culture to send a message. Let's see if we can pull that up, and then we're going to come back and do some wrap-ups.
And while they're pulling that up, Dr. Cook, those mothers who get vaccinated if are pregnant, that also helps the baby. Am I correct?
I'm not sure with regards to like passive immunity. I would think so, but I actually don't know direct data on passage through that barrier. Dr. Webb or Dr. Tuckson may, but I'm not aware, and I can't say that I have read much on the protection of the fetus as definitely protection of the mother, because that mother's at extremely high risk. But with regards to protection of the fetus, perhaps Dr. Webb or Dr. Tuckson know more recent data than I do.
Okay, well, we'll go ahead. I'm gonna pull up the hip hop.
Sure, we have seen that there is passive immunity that goes to the newborn. When they're born, of course, babies don't have an immune system of their own, and so they're dependent on the mother's, immune system to protect them for those first few weeks. And so, yes, that is the case, but we don't know if it's 100% of the time. And so, we know that it has been shown to be the case, but we don't know if it always happens.
And let me thank you all. So when you don't know, the thing to say is I don't know. Thank you, Dr. Cook.
Yeah.
I appreciate that. That's important. And we're all possessors of some truth. And as we bring our truths together, then and only then do we get closer to the truth. Let's go hip hop.
Go ahead, pull it up.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Trust me, believe me, we're not gonna have another Tuskegee. This ain't eugenics, no way. Nobody getting away with hiding information today. Got the FDA, CDC, black doctors and experts for you and me. There's a whole lot of data for the world is free. Do me a favor, check it out and you'll see. I gotta give a shout out to all of those involved that's helping us get this problem solved. People wanna know, is the vaccine safe? It doesn't have anything to do with race. 9 out of 10 people won't get sick. That's 90% effective and legit. We gotta act now. Please don't wait. Get the vaccine before it's too late. For real.
All right.
All right. I just think that's an absolutely wonderful way to get the message out. Now, we ran a little long because we got started a little late. But what we want to do is we know that many of you want to know what the next steps are. And so, Dr. T, I want you to kind of lay out exactly what people are expected to do from this point. And then as we begin, I want you all to think about your last words, your takeaways. Each of you, I'm going to give you all a little time to take away. Mr. Preacher, just short, not mini sermon on this last one, okay? Yeah.
Well, let me just
I can't believe the politician just said that.
Right.
Yeah, that's like the kettle calling the pot black.
Let me say, there is a sense of urgency that we need to embrace. And now what you need to know to schedule your activities, to schedule outreach, to connect with a clinical partner and do what Katrina did to actually bring a vaccine clinic into your barbershop or to have it out in the parking lot. You can begin that process right now. And we're going to have some open hours, so to speak, study hall, so to speak, if anyone needs any hand holding and technical support to get access to the modules. But right now you have everything you need to schedule your events. And we're using that July 4th as a target, as a sense of urgency, something that we can focus on, and recognizing that this is really the first time we brought barbers and stylists from across the country together around a common theme. And we take these lessons forward. We can sustain this beyond the moment. I think this is a movement opportunity. So you are part of a listserv where we are going to be following up, answering the other questions that were in the chat that we didn't get to. So you'll be hearing from us in the next phase, and we'll be asking you to share your flyers, photos of your events, news clippings. This is the time. This is the big push to save our community. Omar?
And Mayor Neal, I just want to jump in and add, because I know some of you may have some real technical questions about what's next. So I want to be more specific for you if that's helpful here. This training, and first, just to frame it, we've got several partners as a part of this initiative. So certainly there's the White House and the Department of Health and Human Services. Health and Human Services is going to send some materials your way that can stimulate conversations in your barbershop. So it's just things that you can post up in the wall, and those will allow folks to see it, and it'll spark some conversation. So that's one partner. Of course, you've got the University of Maryland Center for Health Equity. That's another partner. They're doing this training, and they'll also send out links to some additional modules, as Dr. Thomas just mentioned, that'll round out your education here in preparing your shop to do this kind of work. Another partner, of course, is Shea Moisture, because we haven't talked about it said, but there's money involved, right? They're offering that $1,000 for 1,000 shops. And so, what they're looking for, they're going to be keeping track of what you're doing. They're making sure that you finish all of your training, because that's one thing you have to do in order to get the $1,000. But also, we want to make sure that you're doing the education in your shop and hosting an event. Those are the three things you must do. And then finally, as Dr. Thomas mentioned, we certainly want to make sure that you're holding an event, but we're not leaving you out there all on your own. Dr. Tuckson, who's with the Black Coalition Against COVID, he's working with the National Association of County and City Health Officials. Actually, right after this evening, we're going to get a list of every one of you who's participated in this call, who's gone through this orientation training. We're going to cross-reference it with our list of everybody who's registered. And then we're going to reach out to your local health officials, and we're going to allow them to connect with you. So they're going to get in touch with you directly based on the information you submitted to us, so they can say, hey, it's going to be a pharmacy who's going to come work with you to pick a date, or it's going to be a health system, or it's going to be a federally qualified health center, right? We're going to have those local health officials who are going to be the key to connecting you to a vaccine provider. So you're not all on your own on that. That's part of what this collaborative is about. We're going to get you those resources. We're going to get you plugged in with your local health officials. And then as Dr. Thomas said, we want to make sure we get as many people vaccinated as possible. Of course, July 4th is that urgency, but keep in mind, the sooner the better. So if you can hold an event, sometime by the end of next week or even next weekend, that's so important for us, because that variant is here and we want to make sure that people are getting protected. So hopefully that's just some additional steps to make sure that you know what's coming down the pipeline, and we'll be in touch very soon.
Can that suffice for your takeaway? Tony.
Yes, sir.
Man, what as we get ready to close out, what do you want people to take away from what you are thinking now?
Let me tell you what I took away. This has been so powerful for me. I'm a barbershop owner of 30 years and a master barber, and I work every day and I deal with these questions. This has been so informative, and it's going to spark so many different conversations in my shop. I'm sure the information that was given or disseminated this evening, a lot of people didn't know, in terms of even the Tuskegee Institute, the makeup of the vaccine, the Delta variant. I cannot wait to get behind my chair tomorrow and spark this conversation, because I have 11 barbers and we do this. We go back and forth with this every day. It has been awesome to be a part of this. I want to thank you guys for allowing me to sit in and just share. And I promise you, my location will be a Shots at the Shop location.
All right.
Absolutely.
Wonderful.
All right, brother.
All right, Aaron, what's your thoughts, my friend?
One of the things I will say, if barbershop hosts a vaccine clinic and only a few people show up, don't get discouraged. That's a few people that's been vaccinated. Just look at what you did, make some adjustments, and maybe the next one will be more successful. But don't get disappointed if you don't reach your pie in the sky number.
All right, thank you so very much. Clarence, what's your takeaway, my friend?
First of all, I want to thank you for the opportunity to be here. But I think the thing that I want to say to the barbers and the stylists is that I have 3 points. First of all, you are important. Okay. The second thing is that you do make a difference in our community as it relates to health. And the third thing, you are trusted messengers. And I appreciate your value.
Thank you very much. Dr. Reed Tuckson.
Hey, let me use my minute real quick. Number one, heart issues. Yes, there was a report in the news, and you'll see it, that about 300 people had some issues with inflammation of the heart. It's been studied thoroughly. The risk is very, 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 very small. And what is much bigger than the risk of getting it from the vaccine is from the virus. The virus gives you the same syndrome, but much more often and much worse. Number two, which vaccine will you get? When you sign up, depends on what community you're in. As Cam mentioned, we're partnering with the health officials and which ones are available in the community easily. So it's really dependent on where you are locality. Children's eligibility for the vaccine, let me be real clear that it has absolutely been proven safe for kids 12 and up. 12 and below, the studies are still going on. We hope to have those results in a couple of months, but nobody is going to approve those until they've been thoroughly and fully studied, and we aren't there yet. So that's the truth of that. And how often will you need the vaccine? A next dose, we are still learning about how long the duration of the immunity is from the vaccine. We know it is longer than the natural immunity from getting the infection, and we will have more data that will tell us that. Thank you so much. We want to continue to always answer your questions. Keep asking them.
Absolutely.
Thank you,
Dr.
Reed.
Tuesday Cook.
I don't have much to add. I tried to answer as many questions as I could in the chat and provide links to the CDC and ACOG and actual scientific data, so people could just copy and paste the link in their browser or whatever they're using to attend this conference, and just read that information as well. But even after you read, if things don't seem quite clear, still ask. The only way that you can help to give information to other people is to make sure that it's clear to you. Ask your physician, ask your, nurse practitioner, ask whoever it is you see and you trust. And if you still don't understand, ask again. I encourage my patients to do the same. And I actually have them repeat it back to me to make sure they understand. So each one teach one.
Thank you so much. Okay. Dr. Stephen Thomas, your takeaway before I take it home.
I cannot be more pleased with what we're doing. And to say once again, we're at the intersection of moment and movement. We do this right. We are launching barbershops and beauty salons as a new home for healthcare for Black people. And you're on the front lines of making that a reality. When you talk to Cam about the basketball back and forth, well, people sometimes just like to fuss. And Katrina was telling me they wanted to fuss about mRNA, will it change your DNA? And they wanted her to answer that question. And she said, I'm going to bring the health professionals in here. You ask them. It's okay to say you don't know. We'll bring the expertise to you so people can ask the health professionals who do know. So it's not about a debate. It's about getting the knowledge you need to save lives in our community. That's my take home, Omar. And this is a beginning, not an end.
Absolutely. Well, in honor of Dr. T and in honor of this special moment, I want to say thank you. Thank you to all of the barbers and all of the stylists that have assembled here today. You don't know how much you mean to me and to this esteemed panel. Thank you for being here. And to my panelists, thank you for your honesty and forthrightness. It is through that trust will be established and sustained. Now, if I asked you if you ever heard of a person by the name of Andrew Gold, you probably would not know who I'm talking about. But if I asked you if you ever heard these lyrics, thank you for being a friend. Travel down the road and back again. Your heart is true. You're a pal and a confidant. I'm not ashamed to say, I hope you stay that way. So I take my hat off to you. And it says that, and if you threw a party and invited everyone you knew, the biggest gift would be from me. And the card attached would say, thank you for being a friend. I want to thank you for being a friend to the community, barbers and stylists. And we know you make your friends before you need them. So I want to ask you one more favor, friend. Do something to save the lives of your community by giving them the proper information so that they can have the proper understanding, so that they can gravitate to take care of their own selves and the lives of their family and community. I thank you so much for all you do, both seen and unseen. And as always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power.
All right.
Thank you all for joining with us. Have a wonderful day.
You got the power. You'll be hearing from us.
Good night.
Bye-bye. Be safe out there, people.
Go Hawks.
Here we go.
Bye-bye, Tony.
Bye-bye.
Bye-bye. Love you all. Take care.